Dr. Vani Kulhalli. She'll be speaking on improving cognitive function in bipolar disorder. Dr. Vani completed her MBBS from BJ Medical College Pune. Psychiatry is her chosen path, and she earned MD Psychiatry from NIMHANS Bangalore and is working in Mumbai since 2003. Due to a busy practice, she was able to treat and be with people with bipolar disorder between the ages of 7 to 90 years, both men and women, and of varying severity and complexity. This has been sometimes exhilarating, sometimes it has been heartbreaking, but always rewarding. We are keen to learn from her since this has been an issue of great relevance to our community. Please put your hands together for Dr. Vani.
Good afternoon, everybody. The first test of your cognitive function is whether you all are feeling awake and alert after the nice lunch that we've had. So when I spoke to Mr. Vijay and I was asking him what should we cover, and he said that this cognitive functions and their problems is a important thing that everybody worries about once they've had bipolar disorder. So how do you, my first job is that all of us come on the same page about what we are talking about. What is this cognitive function? So one of the things that I thought was, suppose you have a car, okay, and you can hear me?
Yeah.
Okay. Right?
Yep.
Yeah. So suppose you have a car and this car is going slightly like this. There's some problem in the steering wheel. So you leave it in the garage. And then when you see the car, when you go to pick it up, it looks lovely. It's all shiny, polished. Steering wheel is going quite right, going straight. But your car service is in Kalina, and by the time you reach your home in Andheri, the car has stopped 5 times. So would you regard this as repair?
No.
No. So that is what is now happening in the treatment of all mental health conditions, including bipolar disorder. So the patient comes there, they say, I have a certain symptom. So in the case of bipolar disorder, the symptom is that there is a mood dysregulation. Sometimes you are in low mood, sometimes you are in high mood, sometimes you are going up and down. And with lot of effort from the patient side, family side, doctor side, the mood is set right. So your car is shiny, you don't have mood episodes any longer. You do your mood charting, and every day the ratings are beautifully around 0. Okay. So then the psychiatrist also gives you fit to rejoin work, go back to school or work, or if you are a doctor, go back to clinic, and you go. Most of the patient will come back and say, no, I can't work. Something's not right. So nowadays, all these something's not right is called in common terms as brain fog, memory problem, ADHD, loss of motivation, procrastination. These are all what come under the umbrella of cognitive symptoms. Cognition is the process or is the ability of any person to process information. There are different kinds of information around us. So for example, if I am here, so Mr. Vijay also asked me, would you like to have a PPT? So I said that I don't want to have a PPT because it gives a lot of rigidity, and if there's something coming from the audience, I cannot blend myself. So what I want to do is I want to really use my cognitive functions in real time. I want to sort of pick up that somebody gave a very vigorous head shake to this particular point and I would like them to contribute or something like that. So I would like to process this kind of information. And what would you say that if I just look at my PPT and do the presentation, is that going to be better for you or is this kind of give and take? You tell me. Give and take. Yeah. So when your cognition is at its peak, the way you work, the way you progress in life is completely at a different level. You are able to use all your human qualities and capabilities to the maximum. And though we have lot of instruments to sort of formally measure these functions and dysfunctions, many times in a busy OPD, we really don't have the way, but the person who's going through these problems, they can perceive that I was earlier like this and now I'm not like that. But doctor is saying that I'm better. And family is saying that I'm better. So let me break these points down. What are the components of cognition? The most important component of cognition is attention and concentration. Okay, so the ability, so when you want to process any information, you should be able to identify what is that information, where is that information. The ability to direct yourself in that direction and stay there is called as attention and concentration. Okay, so so this is very important, no? Like for example, air traffic control. Last week there was a aeroplane accident abroad, and why did that happen? Because that attention was not given to that particular thing. That new thing was not processed quickly. So attention and concentration is very, very important. The second thing that we want is working memory. So working memory means, I don't know how many of you all cook, but all of you must be cleaning. Everybody cleans at home. Jhadu, dusting. Yes. So when you are doing jhadu, the simple working memory is that have I dusted here or not? So that you will not go there and dust. It's a small piece of memory which is not like you're going to remember for the next 50 years that you dusted here. But it is very important there, that time. Because otherwise you will dust the same place or forget it. Okay. Similarly, very important is you should remember whether you have added salt or not to your cooking. Working memory. Okay. In medicine, when they teach us what is a working memory, they will tell us it is recall of a telephone number. Gokarn madam will agree. They all tell us working memory kaise test karna hai? 7 items, and usually it is a telephone number. So you look at the telephone number. In the olden days, we used to look at the telephone number and dial it. So that gap is working memory. So that's an extremely important component of cognitive function. Okay. Now the third is planning and ordering. So if you want to do something, you should know what comes first, what comes later. Okay. So if you're doing jhadu pocha, if you do pocha first and then do jhadu, you'll be called really stupid. Okay. And there is no way to cook a vegetable first and then cut it. So now I'm giving you very gross examples. But if you are a medical professional like me, then I have to know that first I have to ask the patient's name and age. Then only I have to ask the depressive episode kab hua tha. Otherwise, the patient will be like, what's happening? Person is not even introducing themselves. So there are many relevances to the order in which you do things. And this ordering and planning and doing them, this is another very critical cognitive function. Okay, now you will ask me, what about intelligence? Most families will come and tell me about how intelligent their child is, especially in child psychiatry. But we are not talking about intelligence and cognitive functions, frankly, because actually nothing happens to intelligence. Any mental illness you have, largely when we do the IQ tests, the IQ doesn't get impaired at all. Most of the disorders, whether it is schizophrenia, bipolar disorder, all these things, So because the long-term memory, the ability to learn something and all remains fairly okay. So when we talk about cognitive dysfunction in bipolar disorder, we are not talking about intelligence. Why am I clarifying this? Because highly intelligent people are also getting bipolar disorder. And then they feel they don't have to do anything else to preserve their cognitive function. And that's how they lose the cognitive function. If your cognitive functions are not good, you will not be able to use your intelligence. That's the hitch over there. So if you have an IQ of 150 and you're doing a lot of mathematical calculations before you had the bipolar disorder, after you had this diagnosis, you're going to slow down. Sorry, reaction time is also one part of cognitive function, how fast you respond. So that also is a part of cognitive function. So you may be very clever, but the way you're responding to your to the environment using your abilities, there's a huge gap, and that is where the cognitive function comes. And cognitive dysfunction is the last frontier in psychiatry. Right now, we have medications to treat every kind of disorder. We don't have a medication to treat cognitive dysfunction. If there's anybody in the world, psychiatrist, American, Indian, NHS, whatever, any pathy, homeopathy, naturopathy, allopathy, whatever pathy, who's claiming that we are going to treat your cognitive function, that's not right. We don't have medications for cognitive function. So now what to do? So have I scared you enough? So yes. Now you will be open to listening to me. Because there's a lot you can do to preserve. I've organized my this thing because I really don't want to challenge my cognitive functions too much. Okay, one point I forgot was, why is cognitive function important? Somebody may say that uh, is it important only for the person? How is it? What is the context of the cognitive function? So, for example, somebody may say that, okay, we have this person who was doing very well earlier, but now we have organized everything for this person, whether it's the finances or the living, and it's in a comfortable space. So, cognitive functions are not important for him. You don't have to earn anything. Sometimes you may say. But it doesn't work like that because cognitive functions also go into the social cognition. And for human beings, social cognition is very critical. Even if you are an introvert person, even if you are a neurodivergent person, social cognition is very important. Now, let me put it in perspective. The attention and concentration part. If there's somebody in your family, you don't have to go out to work, but you have to be able to communicate with that person. So, attending to that, remembering what they have said, responding to that, what have you said, what have you not said, these are memory elements. Okay. Going beyond that, what is the meaning? A lot of times, what we see in bipolar disorder is that misinterpretation of meanings. Suppose a person is in a manic episode and some other person comes and talks very nicely to them, they are of the opposite gender. They may misinterpret that, okay, this person is in love with me. That's also a cognitive error. Okay. Or a person who is in a very depressive episode and their father says that don't spend this much today. They will suddenly feel that they become very poor. So they are going in the other direction. They develop a delusion of poverty. So that is also a kind of cognitive function. So the cognitive function is intimately related to our sense of being human and also our sense of being healthy in the context of a bipolar disorder. And that is why everybody should pay attention to the preservation, to the recovery, and to the enhancement of cognitive dysfunction. Why does cognitive dysfunction happen in bipolar disorder? Let me explain that to you.
No. Mike cognitive is low.
Mike thought it was very technical. So, what kind of cognitive dysfunction is there in bipolar disorder? All these things go for a toss. Your attention concentration is impaired, working memory gets impaired. Whether it is related to the episode, yes, in the episode it is very bad, but between the episodes also there is some impairment that happens, that remains. So, it is not like a dhobi ghat. Sorry, I'm giving a very, very coarse example. You know, that when you're in an episode, you're like a maybe unwashed cloth. And when it comes back from the laundry, it looks like a new starched material. It's not like that. There is something, some deficit that remains inter-episode. And we are actually worried about that inter-episode deficit only. So all these things get impaired. The first reason for cognitive dysfunction is that genetically the problem or the gene that codes the bipolar disorder is sometimes co-inherited with something that also codes for dysfunction. Okay, so it's a part. So even before you develop bipolar disorder, you may have some baseline cognitive dysfunctions. Okay, now what is the proof for all this? Is that lot of people will recall that they may have got a diagnosis of bipolar disorder in their early 20s or later, but when they look back at their childhood, they had some symptoms of hyperactivity, forgetfulness, and then nowadays, because it is so much in the social media, they do go back to their psychiatrist and ask them that, do I have ADHD? Okay, so this is one correlation. Second is, in families with bipolar, of the patient, persons, the relatives who don't have a bipolar disorder, they also have similar cognitive dysfunction, but of a milder or a slightly different type. So there is some genetic link because of which this happens. Why is it important to understand the cause of cognitive dysfunction? Is that otherwise you'll blame the wrong things and you'll try to address the wrong things. Okay, which doesn't mean that if I've told you it is genetic, it is hopeless case. Don't take that, because last year only I've spoken about epigenetics, that your genes can be modified. Okay, this is just a piece of information I'm giving you as to how this story actually develops. That the first point of development is the way the genes, and there seems to be some association between the genes of bipolar and the genes of cognitive dysfunction. The second problem is the bipolar disorder itself will cause cognitive issues. Because if you see, among most disorders, bipolar disorder is the earliest onset disorder. I mean, if you are not aware of this fact, if you see depression, if you see schizophrenia, if you see OCD, if you see the number of other disorders, including substance abuse, the earliest onset is OCD, which is a childhood onset, and second is bipolar, which is typically in the teens. The most common history is typically in the teens. It is missed because the severe episodes come later and those get diagnosed. Otherwise, the teenage disorders are considered as phase, troublesomeness, fighting, teenage tantrums and all that. But it's an early onset disorder. So when the disorder is onset at an age when your cognitive functions are developing, what do you expect? There is a kind of dysfunction that occurs there. So that is the reason the bipolar disorder affects cognitive functions. The third is also that right now we have lot of evidence that bipolar disorder is not only something that happens in the brain and the behavior, but it creates lot of neurohormonal changes in the body, which we call as inflammatory changes. So inflammatory changes में क्या होता है कि lot of immune cells, immune substances, they come and they sort of cause problems to your brain cells. They irritate your brain cells so that they don't grow properly, they don't live happily. So then there is slowing of those brain cells. And typically they have shown these slowing happening in a place called as the hippocampus, which is the site for memory, and the prefrontal lobe, which is the site for most of the working memory and all those things. So this is good because this is reversible through medication and treatment. So this is something we actually don't worry that much about right now. So this is the story about cognitive dysfunction in bipolar disorder. What is the next cause? Next cause you see is that person with bipolar disorder or in general mood disorder also have very unique metabolic challenges. More than 50 to 60% of the people will have a condition called as insulin resistance. Okay. Now the insulin resistance comes out as there may be sugar metabolism is abnormal. Some people may get diabetes, PCOS, exactly, PCOS. And all these things, they again feed back into causing a cognitive dysfunction. Okay, so earlier when we were students, we used to use a lot of valproate in bipolar disorder. And then we used to think that maybe this sodium valproate is causing the insulin resistance. So then now we are not using sodium valproate that much. And then we also sort of spoke to neurologists who were seeing patients of epilepsy with sodium valproate and they didn't have that much PCOS. So then that gave us the idea that there is a third reason. And now we found that reason that again it is like being inherited together. The clustering of families, where the insulin resistance. And the insulin resistance is not good for the brain. Over a period of time, it can sort of play negatively with your cognitive functions. Second is, yes, bipolar disorder is also related to certain lifestyle challenges. See, the way the world goes and the way the things are happening, unfortunately, a lot of people can cope with their symptoms only by using some or the other way of substances. So substance abuse is a huge part of what we see in bipolar issues. And substance abuse by various pathways, it can cause cognitive dysfunction because they are toxins. They'll go directly and they will harm your brain. So there is a direct harm that is causing. Second is obesity is quite a common problem. Here I would like to say that medication also plays a very large role in cognitive dysfunction. Many of the medications, especially those which we use for manic episodes, they can cause blunting. They cause actually the patient to feel sedated, dull. Because that's what we are thinking, okay, this person is fast, let us slow him down. Okay. Plus the antipsychotic agents, through their dopaminergic pathway, they cause a slowing of thinking. So that is a known side effect of medications. So medications also have a role to play in cognitive dysfunction. And main thing that they will impair is reaction time. Okay, rather than working memory or executive dysfunction, the main thing that medications will do is they'll slow your thought process, slow your listening. They don't have that much effect on attention and concentration, which a lot of people feel that maybe attention and concentration is impaired. But medications don't have that much effect. The key effect is that slowing happens. So these are among the main things that we also know that in bipolar disorder gets controlled within 10 to 15 years of starting this thing. I mean, it's a cyclical thing. It takes time to decelerate the cycle, but then later there is a stability. But what we say interval ke baad, bipolar strikes again through metabolic challenges like cardiovascular disorder, diabetes, obesity, and this is a part of the bipolar disorder. Also, till recently, the tradition in psychiatry was not to look at it. Now we are looking at it, and therefore it's also a thing that inadequate healthcare has resulted in side effect. But these things can impair your cognitive function. So these are the reasons for having cognitive dysfunction. Now, when you see what we say a standard issue, for example, substance abuse or obesity or diabetes or PCOS and so many other things, These are risk factors every population has. It's nothing specific to bipolar disorder. So what is it related to bipolar disorder that you need to sort of remember? You need to remember that the longer you are in an episode and the more severe the episode is, the cognitive dysfunction increases. And that is why it is extremely important and urgent to get fast remission and to remain in remission. Because why I'm saying this is because a lot of people who have widely spaced episodes, see, everybody is not equally lucky. Okay, some people have one episode in 1998 and next episode in maybe happening 2018. So there's a 30-year gap. Some people have 3 episodes every year. So then people come and ask us that if the episodes are widely spaced, 30-year gap chodo, but if the episodes are 2 years gap, 3 years gap, why should we take medication regularly? The answer is this. The answer is you have to prevent next episodes. Because every time you go into a next episode, your cognitive dysfunction will not come to baseline. There will be some deficit. And that deficit will keep on accumulating. And eventually you will reach a level of cognitive dysfunction. So we see, like I told you, we have patients who are in their 80s or 90s. Their mood is quite stable, but they're just sitting in one corner like vegetables. That's not what we expect from healthy aging. So you won't be able to do your healthy aging. You will become aged faster than the other people. That is the deal you will get if you keep on getting recurrent episodes. That is if your episodes respond and you don't have to go on 4 mood stabilizers. We also seen that kind of things. So that brings us to the most important answer or discussion of today is that how should we improve our cognitive function? The short answer is that if you have bipolar disorder, keep it under control at any cost. Okay, so lot of times we see people thinking कि बहुत ज़्यादा medicine है, then they read online कि lithium का ये है, valproate का वो है, lamotrigine का वो है. So don't take personal decision. The most important priority if you have a bipolar disorder is to keep your mood stable. Once your mood is stable for several months, because that stability needs, it's like a cement pole, If you put a cement pole, you have to leave it till it sets. If you shake it constantly, it will come out, even if there is cement. So similarly, once there is a medicine you have given to achieve normalcy of mood, that medicine has to be left there, unfortunately with its side effects, for some time so that the disorder is properly consolidated out of the picture. Once that is done, then you negotiate with your psychiatrist about the side effects. You have to be really aggressive about it. You have to work because the slowing of cognition is a real thing. Mood stabilizers don't cause that much slowing. The most offending medications which cause cognitive slowing are older antipsychotics. Typical antipsychotics like haloperidol, chlorpromazine, thioridazine. Luckily, these are not used much. Okay, even risperidone. The modern medicines like aripiprazole, cariprazine, these don't cause that much cognitive slowing. Lot of people are under the impression that lithium causes cognitive slowing, but research has shown that lithium actually improves cognitive function because lithium is a neuroprotective agent. Whatever damage that I told you due to the inflammation and all, that is reversed by lithium. So moral of the story, and not because I'm a psychiatrist, I'm telling you the research that mood stabilizers do help to preserve and recover cognitive function. What should be your next on the agenda? Next is to get your lifestyle in picture. What can you do? So like some time ago, Shukriti told us about regular time of waking up, regular time of doing all your activities. These do help a lot in recovering your cognitive activities. So if you do all this, your general health also improves. Physical exercise, you don't have to go to the gym actually. Simple things, 40 minutes of walking at whatever speed suits you, wherever it suits you. There is an excellent YouTube channel called Walk at Home. It has programs from 7 minutes to 40 minutes. Whatever suits you, you can do. If you are disabled, if you are not able to stand also, there are excellent YouTube channels about senior citizens exercise, exercise from the chair, whatever is possible. Minimum 40 minutes per day consistently. Now that's a thing to do. Start with once a week, then make it twice a week, then thrice a week. Once you've done thrice a week, you've got it. It's a very simple thing after that. So regular exercise is an excellent mood stabilizer. It will help you in two ways. One is your mood stabilizer dose can be optimized. Maybe they can reduce it. That will reduce the side effects and other things that are happening to you. Second is independently also it will help you to improve your cognitive functions. Third is engaging your brain regularly in brain sustaining activities. Now here I want some responses from you. What activities do you think keep the brain healthy as far as using the intelligence is concerned? I want responses from the audience.
Reading, I do Sudoku and I do NYT, all the games.
Excellent. Yes.
Reading.
Reading. Yes.
Crossword.
Crossword. Yes.
Playing chess, blogging.
Excellent. This side. Huh? Music and movement. What else? Dancing. What else?
Learning new language.
Learning new language. Yes.
Watching Netflix.
Watching Netflix. Yes.
Interesting conversations.
Interesting conversations. Yes.
Watching talk shows.
Watching talk shows. Yes. Ma'am. Painting and knitting. Yes. Pranayam.
Working on your hobbies.
Working on your hobbies. Excellent. Yes.
Do you think solving paradoxes or reading contradictions
Yes. Solving paradoxes.
would worsen it, right? It would worsen it, right?
Not to worsen. I'll tell you how not to worsen it.
Solving puzzles, jigsaw puzzles.
Jigsaw puzzles.
Talking regularly to your wife.
How sweet. Humor books. Excellent. I think we have a complete menu of things here. This is what the brain needs. Whenever you're looking at looking after your brain, things should be feasible, accessible, enjoyable, stimulating, engaging, and mildly challenging. That is what you have told me. You know. So if Umang likes painting and drawing, it may not be my thing. Okay, so everybody has to have a different answer for what interests them. Okay, that is one way to look. That is the modern way to look at cognitive stimulation. What was the olden days way?
Prayer.
Prayer.
Community meetings.
Neighborhood, village, whatever communities coming together.
Beautiful.
Chai Geet.
Huh? How did we study? बचपन में the previous lamppost ने see जबरदस्ती का काम बैठो और भूकंप पट्टी करो see रट्टा करो. So I am not saying that you do ratta. The point I am trying to do is trying to tell you is lot of mundane repetitive activities which we dismiss as phaltu. They actually give us the best cognitive exercises. Laundry.
Some examples.
Ration is no longer what it was, okay? The rice is much better. So,
Some examples like
Like she said, laundry. I'll tell you. Huh? Cleaning the house. Huh?
Gossiping.
Gossiping. Gossiping again, it is personal. Some people like, some people don't like. But I need to give you something here which is applicable for everybody.
Okay. Washing utensils, cutting vegetables.
Yeah, housework. Housework. Whatever housework you do.
Thank God my wife is not here.
Yeah, I knew that. No, and it's not coming from a place that I am a wife. हाँ ऐसे कुछ agenda नहीं है इसमें. This is proved. I'll tell you how. Okay. So you are doing housework, and housework cannot be done properly unless you pay attention to it. Okay. So typically we say no कि क्या झाड़ू मारती है फ्लोर से 1 इंच ऊपर झाड़ू रहता है ऐसे नहीं होता. So you can't do झाड़ू without looking at it. So you have to look at it. You have to pay attention. Okay. Like I said, working memory is tested. I mean practiced, because you have to remember what you have done, what you have not done, what you should not repeat. You have to plan and execute it because it has to be done in a certain way. Okay. Then in the gym, no, see what happens is if you're doing mandala or you're gossiping or you're doing dance, no, the element of repetition is not there. Today you will dance on Chaya Chaya, tomorrow you will dance on some other song. Housework is not like that. You have to repeat it. Okay, when you repeat things, no, particular neural networks get strengthened. So initially there is a lot of boredom because it is monotonous work, and socially as a society we have called it some kind of third class work. Okay, but it is no less than meditation. I dare you, if there is an intelligent researcher who will do a case control study comparing between the benefits of housework and pranayam, I'm sure housework will come first. Because we do this, when you're doing it, you have to cut off from the rest of the world. You have to concentrate on what you're doing, otherwise you will make mistakes. And housework mistakes are not acceptable because other people are also looking at it. Okay, so it's not which housework. The good part is that you can choose the housework that you like. Some people like cooking, some people like cleaning, some people like doing laundry, some people like doing ironing. So doing at least one household task on a regular basis keeps your brain fit. More than above that, you can do Sudoku, you can do painting, you can do dancing, you can do gossiping, you can do whatever you want. But see, it is like this, unless the foundation is built, the building cannot be built. And the foundation is built through simple, repetitive activities which deal with the core competences that form your cognitive function. Once you have these in place, no, then your old skills will come back. So if you had been a mathematician, you'll do well in maths. If you had been an engineer, you'll do better in engineering. If you've been a doctor, you'll remember all your medicine faster. And your social cognition also improves. So the moral of the story is, preserving cognition is just 3 things. Keep your bipolar disorder in control very aggressively. Keep your general health in control by eating well, exercising well, sleeping well, and not getting medical problems. And third is, pick up any repetitive activity which can be easily done at home. See, and the standard of housework also, na, it is like you can even have an Olympics. Some people will just wipe the floor. Some people will polish it. So in that also you can do A grade, A plus, A excellent, O, everybody. So there is a striving in that also. So I think that is what I would like to say today. 255. Thank you. Are there any questions?
Yeah, hello.
We are behind time, yes, please. Lunch is after lunch. We began 10 minutes later. The session began later. The doctor is around. We can discuss.
Yeah,
this in
I
free
think
time.
you'll
Please
continue.
respect her. Yeah, please. Yeah, doctor, you're not around.
Yeah.
Can we have a big round of applause for Dr. Vani?